Small animal comparative anatomy and physiology. Learning Outcome 1, AC1.C, wants for you to be able to describe fundamental differences between three species with regard to anatomy and physiology. We've looked at the anatomy and physiology of the canine and feline species, and this PowerPoint focuses on the differences in relation to the anatomy, and we're going to be focusing on that of the rabbit and the guinea pig. Rabbits come under the mammalian order of Lagomorpha, thus we can call them lagomorphs. They are a burrowing herbivorous animal. They live in large social groups. They are a prey species. Their anatomy is adapted to sensing danger and allowing them to make a quick escape. Our modern breeds of rabbits are derived from that of the wild European rabbit. It weighed around 2.5 kilograms and was covered in a thick brown tipped fur or duty coloured. And the purpose of this was to break up its outline and allow for it to have camouflage. Now, selective breeding over the years has allowed the development of over 50 breeds of domestic rabbits, and they weigh from between 1 to 8 kilograms. They have a variety of fur textures, colours, size, shapes, ear positions, etc. And unfortunately this makes them unsuitable for life in the wild. The European wild rabbit would have had a rounded head with long upright ear pinners set high on either side of the head. Those ears were large, making up around 12% of the body surface and very vascular, thus that really enabled them to be utilised for thermoregulation of the animal. Nowadays, we must consider that the breeds that we are producing may have very different ears. So consider that LO1 ears have ears that hang downwards. So this wouldn't be as relevant if we were to compare them to the European rabbit, where because of the ears being very mobile and allowing them to pick up signs of danger, they would then be able to act accordingly. Because we've got these differences due to selective breeding, that isn't as much of a factor and thus makes them unsuitable for life in the wild. Lagomorphs continued. Their eyes are protuberant and set on either side of their head. This provides a wide range of monocular vision to protect them from predators, for them to be able to detect them. They are active at dawn and dusk, and we term this as crepuscular. Thus their sight is adapted to cope with lower intensities of light. Their lips are made up of soft tissue and have a sensitive covering of hairs. The upper lip can be seen to again be divided by the philtrum, enabling for them to nibble grass. As female rabbits mature, they develop a dewlap, as you can see from that image, bottom right, which is a large fold of skin under their chin. And this is used for them to be able to pull fur from, which is utilised to line their nest prior to parturition. Rabbit skin has a really good supply of scent glands, and these are used for territorial marking. They're located around the body, under the chin, anus, and either side of the perineum. Their forelimbs are short and used to dig, and their hind limbs are longer, providing the force required to enable hopping. Their hind limbs also assist with kicking out of the way dirt in order to aid the forelimbs when digging burrows. They have 5 toes on each forepaw and 4 on the hind limbs, and each toe has a sharp claw. We need to take care of these, especially for those that are long and straight on the hind limbs, as they can cause you some harm. They have no foot pads, they're completely covered in fur. When at rest, you would see that the rabbit's plantar surface of the hind limb or toe hock actually rests on the ground. Wild rabbits would graze in groups, and there would always be a lookout bunny. They use the hind limbs to stand upright to enable predators to be seen. The danger warning is the use of the hind legs to thump the ground. These behaviours can also be seen in our domesticated rabbits. In the wild, rabbit tails are short and fluffy with white undersides, and this allows, when running, the white undersides of the tail to flash to alert others to danger. Again, due to selective breeding, you may find that we don't have such a marking on the tail of our domesticated rabbits. The musculoskeletal system of the rabbit. Remember that the skeleton of a rabbit is delicate if we were to compare it to that of the dog or cat. We need to take great care when handling rabbits in practice. It is actually only about 7 to 8% of the animal's total body weight, so a much lower percentage than that of cats and dogs. The long bones have a cortex that is thinner than those of the cat. In relation to vertebrae, these are the following numbers within the general areas. Cervical 7, thoracic 12 to 13, lumbar 7, sacral 4 and coccygeal 16. So what are the differences relating to the skeleton of the rabbit? If we were to compare the skeleton of the rabbit to the cat and dog, we would see some key differences. They are as follows. The scapula is more triangular and sharp in nature. It has a pronounced hook shape, which we call the suprahamate process on the acromion. The acetabulum, the socket of the hip joint, is comprised of the ilium, ischium and the os acetabuli. This is an accessory bone, and in contrast to the cat, we don't have any involvement of the pubis in relation to the formation of this socket. Within the forelimb, we have total fusing of the radius and ulna, and in the hind limb, the fibula is half the length of the tibia and is fused with it. The muscle is a paler pink colour compared to cats and dogs. Try and have a look next time you assist with rabbit surgery. The digestive system. The herbivorous. They may be called little horses. This is because they are both hindgut fermenters, meaning that the main chamber for the breakdown of plant material is part of the large intestine. However, in comparison to the horse, the GI system of the rabbit allows rapid passage of food through the tract and quick elimination of fibre. Due to this, the size and weight of rabbits has remained small, allowing it to be able to rapidly get away from predators when required. The digestive tract itself is quite long. It makes up 10 to 20% approximately of the body weight. The oral cavity. The opening of the mouth is small, in design for nibbling grass. They have a relatively large tongue, which is long, and a curved oral cavity, and this makes examination of the cheek teeth and also intubation difficult. See if you can have a look next time the veterinary surgeon is examining a rabbit's mouth. The teeth are classed as open-rooted, thus they grow continuously throughout their lifetime. This is why hard or fibrous food materials, i.e. hay, is vital for their diet. You will see there the dental formula that I've underlined and popped into red for you. What I would like you to do is research the term malocclusion. Digestive system. Dentition continued. So their incisors only have an animal on the outer surface. This wears slower than on the inner surface of the tooth, and this then creates the characteristic chisel-shaped tooth, and this shape is needed to enable nibbling of plant material. In the upper jaw there is a second pair of incisors, and these are vestigial, i.e. they're a remnant from days gone before, so they are just something that are remaining. We call those peg teeth. They don't have any canine teeth, so thus we have a space between the incisors and the cheek teeth termed a diastema. The premolars and molars are termed cheek teeth. They are flattened teeth that enable the grinding of food, and the jaw moves in a circular motion to enable forcing of food against the surfaces of those teeth. And it is said that the lower teeth grow at a quicker rate than the upper teeth. The stomach and small intestines. The rabbit stomach is simple, it's a thin walled chamber, and it acts as a food reservoir and is never truly emptied. It has a well-developed cardiac and pyloric sphincter, and rabbits cannot vomit because of the arrangement of the cardia. Small intestine. The duodenum and the ileum are long and also have a small size of lumen. The ileum terminates at the cecum, where we have a rounded structure that is called the sacculus redundus. Within this is the mucus, and it's arranged in a network of lymph follicles called the ileocecal tonsil. The large intestine. The cecum is the largest organ in the abdominal cavity, and it lies on the right side. It is a blind ending, thin-walled and sacculated, and it coils around other organs, and it actually folds in on itself a total of 3 times. Intestines and digestion. It terminates in a variform appendix that contains a large amount of lymphoid tissue. Again, it's a vestigial, so a remaining thing from times before, and it's a hollow tube that is closed at one end and is attached at the other end to the cecum. We then have food passing on to the colon. Again, this is sacculated, but it's shorter, with a lumen of a smaller diameter. So remember, from a digestion point of view, that rabbits are herbivorous, monogastric, hindgut fermenters. They eat plant material, and this is the reason why. The plant material is moved down the tract utilising peristaltic movements, and it encounters enzymatic digestion within the stomach and also the small intestine. When it reaches the cecum, the material is partially digested. Here it mixes with microorganisms that are in colonies that are responsible for the fermentation, which enables the breakdown of the cellulose that is found within the walls of the plant cells that the animal digests. It is now a semi-liquid material that goes onwards into the colon. However, contractions occur which pass the fluid back into the cecum to be reused in the process of fermentation and to separate fibrous and non-fibrous materials. And this means that we then have two types of fecal material produced. Fecal material. The following is very important for you to be aware of, so please make note of this. We have hard fibrous pellets. They're produced within 4 hours of the rabbit eating, and this is because of the rapid movement of the fibre through the GI tract. This matter is important for stimulation of gut function, but doesn't present or produce any nutritional value. Soft pellets, or cicatrophs, are produced within 3 to 8 hours of eating, generally at night. They are greener, covered in mucus, low in fibre and high in protein, vitamins B and K and volatile fatty acids, i.e. they produce and present lots of nutritional value. Because of this nutritional value, rabbits will actually eat cicatrophs directly from their anus, and this is termed cecatrophy or coprophagia. Rabbits swallow them without chewing, and the purpose of the mucoid covering is to protect the cecatroph from the stomach acids and allows the absorption of nutrients within the small intestine. So in basic terms, this process allows nutrients that have been produced through the fermentation process to be provided to the rabbit. So food material actually passes through the GI tract twice in 24 hours. The respiratory system. Rabbits are obligate nose breathers. Mouth breathing in a rabbit is not a good sign. Their glottis is small and difficult to see due to the large tongue. Intubation can be difficult, and there are a couple of techniques you may have encountered in practice, and we must be very careful to avoid laryngospasm, so actually causing spasm of the larynx. The thymus gland is a considerable size even in the mature rabbit. It lies ventral to the heart and cradling to the thoracic inlet. The thoracic cavity itself is small, and breathing mainly involves diaphragm, and we must take care when it comes to positioning animals for surgery that we ensure that the respiratory system is not affected detrimentally by a positioning of the patient. So we generally would ensure that the chest is higher than the hind regions of the body, so that we're not actually causing detriment to what is already a very small cavity and allowing it to be able to expand, etc., as it needs to do so. The lungs have 3 lobes, and the cranial lobes are small in size. The urinary system of the rabbit. Kidneys are classed as unipapillate. This means they are made up of a single medullary pyramid that drains into the renal pelvis and ureter. In the female, or the doe as we should be terming her, the ureters drain into the bladder. They're tough in nature, though thin-walled, and the urethra empties into the ventral wall of the vagina. In the male, known as the buck, the ureters drain low down on the neck of the bladder. Urine. In a healthy rabbit, normal urine can vary in colour from a deep red to yellow or white, so very different to that of the cat and dog. Its turbidity may also vary from clear to cloudy, and this can be due to the presence of calcium, and this is because the kidneys are the main route for the body to excrete calcium. Their serum levels depend on dietary intake. If excessive, it may cause calcification of the aorta and the kidneys. The reproductive system. The male has 2 testes. In the adult male, these lie in 2 scrotal sacs, so they can be classed as hairless. However, we may beg to differ if you've actually helped to prepare or watched a rabbit castrate being prepared for surgery. And the scrotal sacs are situated quite cranially. The testes descend at 12 weeks, but the inguinal canal remains open. They do not have an os penis, and the buck has no nipples. The scrotal sacs do appear quite different in relation to that of the cat and dog because of where they are situated from a cranial point of view, but also because they are quite elongated in their shape. The female. Again, the tract is classed as biconcornate, so it has 2 separate horns, and again this enables for it to hold litters of young. They don't have a uterine body, and each horn has its own cervix opening into the vagina. The mesometrium is a major area of fat storage, so you will see, if you or even if you haven't as of yet, when you see a rabbit being spayed, you'll probably be quite surprised at the amount of fat around that area and also the coloration of the fat. And as we've already said, their muscle, etc., is quite differently coloured to that of the cat and dog, so actually spaying a rabbit appears very different to that of the spaying a cat or a dog. And they have 4 or 5 pairs of nipples. The reproductive cycle of the doe. They are an induced ovulator. Their oestrous cycle is not all that well defined, and they have periods of sexual receptivity every 4 to 6 days. Ovulation will occur within 12 hours of coitus or mating having taken place, and the sexual maturity for a rabbit actually varies depending on their breed. So in a smaller breed it is as early as at 5 months, whereas larger breeds will be around 8 months. Their young are termed atrical, so they're born hairless, deaf and blind, dependent on the mother for the first few weeks of their life. The dam used as a nest for protection from predators and also the environment. However, if they were to be disturbed in some cases, the dam may actually eat the young. Wild and also pack rabbits only feed their young once or twice daily. Sexual differentiation. It's difficult to do in young rabbits. It's certainly easier after 12 weeks when the testes would have descended in the male. In the male, the penis can be easily extruded and has a pointed end, and over 5 weeks of age have relatively large scrotal sacs. In the female, the opening to the vulva is slit-like. The teats can be identified along with the ventral and abdominal body wall. The hystricomorph group. The guinea pig, or the cava porcellus, also called the cavy, has its origins in South America. In South America, it's actually still used as a food source. They are sociable animals that live in large groups. They are diurnal. Adults measure between 25 to 30 centimetres, the male being larger than the female, and they weigh around 750 to 1200 grams. Their body is short and stocky. They have short legs and no tail. 4 toes in each forefoot, and 3 on the hind ending in a claw. Their nose is rounded and the mouth is small. The upper lip is split on which there are long sensitive whiskers. Their ears are small and delicate and quite hair-free. They have good hearing and can actually hear things at a frequency higher than that of humans. Their eyes are prominent and located on either side of the head. Their eyesight is good as they have excellent peripheral vision to allow them to spot predators. Their sense of smell is also very good. Their natural coat is short and smooth. It consists of dark brown or tipped agouti coloured hairs that provide them with camouflage, and selective breeding has provided a range of colours, coat lengths and patterns. They have an abundant supply of sebaceous glands in the skin around the anus and dorsal skin surface, and they use these to mark territory by rubbing the areas in the ground. And both males and females have a pair of long inguinal nipples. Skeletal and GI system. We'll start with the skeletal. At the base of each ear you can easily palpate their tympanic bullae, which are large vertebrae that are 7 cervical, 13 to 14 thoracic, 6 lumbar, 2 to 3 sacral, and there are also 4 to 6 coccygeal. They have 30 to 36 vertebrae in total. They have 13 to 14 ribs, the last 2 are cartilaginous. They have a small clavicle which attaches between the scapula and the manubrium. In the female, the pubic symphysis actually remains fibrocartilaginous until around 1 year of age, and after that time it becomes ossified. Thus parturition of young is difficult in older sows for their first litter. However, in the younger female, the symphysis relaxes and a gap will be able to be palpated prior to them actually giving birth. In relation to their GI system, they are monogastric, they are a herbivore, so again they have a large cecum to allow fermentation of plant matter. We can see here their dental formula, and they have 20 teeth in total. Their incisors and cheek teeth are open-rooted, again allowing continual growth. They require fibrous food to enable the wearing down of said teeth. GI system. The oral cavity is small and narrow. Again, like in the rabbit, the tongue is relatively large in size. Within the oral cavity there are 4 pairs of salivary glands, and they empty into the oral cavity near the molars. The soft palate is continuous with the tongue base, and the oropharynx connects with the rest of the pharynx, and this is done utilising a hole in the soft palate that is termed the palatal ostium. The stomach is of a simple format, and it's lined with glandular epithelium. For gastric emptying to occur, it takes approximately 2 hours. The intestinal tract is said to measure 2 metres approximately. The small intestine is located mainly on the right-hand side of the aspect of the abdominal cavity, whereas the large intestine is mainly central and to the left-hand aspect and is much longer. The cecum is around 15 to 20 centimetres. It is thin-walled, sacculated with lots of pouches that have been created by bands of smooth muscle, and at any time it may contain around 65% of the gut content. The GI system, liver, and the urinary system. As with rabbits, the microorganisms within the cecum will break down the plant material. They'll break down the cellulose and add nutrients such as vitamin B. The total amount of time it takes for food to pass through the tract is approximately 20 hours. However, it can take as long as 66 hours if coprophagia is considered. And coprophagia can take place up to 150 to 200 times per day. The liver itself has 6 lobes and the gallbladder is very well developed. The liver can't synthesise vitamin C, so deficiencies of vitamin C can occur if the animal doesn't receive the daily dietary source, such as that of fresh greenery or supplements. So it's really important to ensure that guinea pigs are receiving such aspects in their diet to ensure that a deficiency does not occur. Symptoms of vitamin C include a dull rough coat, a stiff gait, lameness, pain on movement, diarrhoea, anorexia and general lethargy. The urinary system. Each of the kidneys has a reasonably large renal pelvis with a single papillae, which is a small rounded protuberance. Urine is alkaline, thick and cloudy, and it's white or yellow. And crystals would be quite a normal finding in guinea pig urine. The reproductive system. The male is called a boar. The testes are able to be retracted through the inguinal canal, as this remains open throughout their lifetime. In the mature breeding boar, the large testes will lie in the scrotum, located on either side of the genital opening. They have several accessory glands internally, a long called vesicular gland, coagulating glands, and bulbourethral glands. There's also an os penis. Called eventually to the urethral opening is a pouch that contains 2 horny styles or projections, and these are reverted externally during erection of the penis. So very different if we were to compare them to the cat or the dog in relation to their reproductive setup. The female is termed a sow. Her uterus is biconcornate. It consists of 2 long uterine horns, a short uterine body, and a cervix leading into the vagina. They are polyestrous and a spontaneous ovulator, and their gestation period is 63 days. It's quite long when compared to other rodents. The young are precocial, and that means they are born fully covered in fur, their eyes are open, and they can be independent of the mother. Thus this means they can eat solid food quite soon after birth, whilst also suckling from the mother. Sexual differentiation. Relatively easy to sex in comparison to other rodents. The male has clearly defined testes, and the penis can be prolapsed by applying gentle pressure at its base, and that is done so cranially to the urethral opening. The female has perineal tissues that form a Y-shaped depression, and the vulvar opening lies at the intersection of the Y. If the pressure is applied like in the male, there would be no prolapsing penis produced, and both sexes have a pair of inguinal nipples. So in summary, as required, we have covered Learning Outcome 1, 1C, describe fundamental differences between 3 species with regard to anatomy and physiology. We've actually covered it for 4 species to give you a good idea of rabbits and guinea pigs, and for those of you that would lead on to the Level 3 diploma, this will provide you with a really good basis of knowledge, as the Level 3 diploma companion animal will cover cat, dog, rabbit and guinea pig only.